Hi, thanks for joining me for Monument Health's Insurance 101 Explanation of Benefits. My name is Heather. I'm a Population Health Coordinator with Monument Health. And today it's my goal to help you understand what exactly an explanation of benefits is and how it can help make sure you're not overpaying for care. So, what exactly is this explanation of benefits or EOB? The EOB is the insurance company's written explanation regarding a claim showing what they paid and what a patient must pay. This is provided to both the provider's office and you, the patient. This tool is one of the most important tools you have to make sure you're paying the correct amounts for your care. This is just an example of what you might get from your insurance company, and while they all look a little different, they'll have the same information available to you. After any visit to a provider, you'll want to check to ensure that the visit is getting billed to you properly based on the EOB and your benefits. Make sure you know where to look on your benefit grid to check what your plan covers when comparing those benefits to your EOB. If you need to learn more about the benefit grid, you can check out our other video, Insurance 101 Benefit Grid. You can also call your insurance or Monument Health for specifics about your plan. Now remember, the EOB is the tool to help you understand your bill, so let's learn how to use that tool. The first section on your EOB gives the details of the claim, like the date of service, name of the patient, claim number, insurance plan identification, and provider information. It's also going to tell you that this is not a bill. You'll not be sending payment to the insurance company for your care, and this is not the bill for your care, but the tool to help you understand your bill. There will be a section that breaks down payment information. You'll see the date of service and a description of service or the provider seen. You'll need to match this information with each bill. You may have multiple bills on one EOB, or you may have multiple EOBs on one bill. Checking for these specific pieces of information is key in matching the costs of each claim. You'll see how much the provider's office charged before the insurance was billed, followed by any adjustments made per the practice's agreement with your specific insurance. This is an amount that your insurance company has contracted with the providers for you, and you may see this phrased as insurance discount. The total charges minus the provider responsibility amount will be the allowed amount or allowed billing amount. This is the amount the provider is allowed to charge for these services, but it still may not be the amount that you'll have to pay. Depending on your plan, some services aren't covered, and you'll see those charges shown as well. Knowing what providers and services are covered by your insurance will help keep you from having any costs in this section. And while not common, you may also see if there are other insurance plans covering services, if that's applicable to you. The next section should cover the copayment and coinsurance, which are cost-sharing amounts that are your responsibility. These are the numbers that you can check against your benefit grid. The amount paid section is what the insurance has paid the provider for the office visit. This is the amount that is the insurance portion of the bill or the portion of the coinsurance. The most important part on the EOB to look at is the amount that you owe. This can also be phrased as the amount you may owe, depending on your plan. When you get a bill from a provider, the amount charged to you should match this number from the EOB, which should also match the benefit amount on your benefit grid. If these numbers do not match, then you'll want to start to determine why that might be. If you have questions or need help, please call your insurance company or Monument Health. This is a great way to ensure that you do not overpay for your healthcare expenses. The last important part of your EOB is the summary section. Here you'll be able to see notes about how this particular claim was paid and where you are towards the deductible and out-of-pocket max. Keep in mind, this amount is after the claim the EOB is for. You may still have other claims in process or that haven't been sent to the insurance yet. Deductible and out-of-pocket amounts are calculated in the order that the claims are processed, which can get confusing if you're not paying attention to the order in which those EOBs come to you. Remember, you can have multiple claims for a visit, so if there are multiple providers or facilities involved in the care, you're going to have several claims. And if claims need to be reprocessed or were rebilled at any point, you may receive multiple EOBs for the same claim and provider. Once you see that your benefits, bill, and EOB are all in alignment, you can confidently pay your bill knowing that it's been processed correctly. Keeping your bills and EOBs together is a great way to ensure that you always know what you should owe for each bill and where you are towards your deductible and out-of-pocket max for the year. If you ever have questions about bills or claims, you can call Monument Health or your insurance directly for more assistance. We encourage you to be an advocate for yourself and your healthcare and finances. Knowing how to utilize the tools given to you can help make you a better consumer and advocate for yourself. I want to thank you so much for taking some time to watch this video. You can reach us by phone or email, or even have many of your questions answered on our website or through our other videos. And don't forget to make it a great day.